Hello everyone, I'm Dr. Sreechithra from Healthcare. Today I'm here to talk about heart attack or myocardial infarction. So heart attack happens if there is a reduced blood supply to your heart muscles or even blockage of blood supply to your heart muscles. If this condition persists beyond certain time, then definitely your heart muscles can die, and this can cause a serious derangement in the functioning of heart, which will have a serious complication throughout your body. So this is a very fatal condition. So it is a medical emergency, and it is important that you have to rush the patient to the hospital immediately. They will treat the patient with nitroglycerides, which is a vasodilator, which can dilate the blood vessels and can restore back the blood supply to the heart. So the timing is more important. So saying that, now let us look into the symptoms of heart attack. The pain of the dying muscles, we call it angina, and this is the most characteristic symptom of the heart attack. And the pain will be usually localized in your chest, and definitely the pain might radiate after a few minutes. The pain might radiate to your jaw or to your left hand or to your both hands. The pain is always associated with palpitation, with anxiety, shortness of breath, insomnia, or you will not be able to sleep properly, nausea and vomiting. There will be lightheadedness, giddiness, and even fainting. So these are the symptoms associated with angina. This can be easily mistaken as gastritis, so you have to be very, very careful out there, especially if you are a person after 40. Now let us see who are more prone for heart attacks. So definitely people coming from positive history, family history of cardiac diseases, people with poor lifestyle, people who are obese, people with uncontrolled systemic diseases, and people who are having a very poor diet and no exercise. So these are the people who are more prone to cardiac diseases. So now if you look into the gender factor, males are more prone to cardiac diseases, especially people who are above 40, if they are male, are more prone to cardiac diseases. Females, they have this hormone estrogen. So this estrogen protects the body from many things. It protects the heart, it protects the body from inflammation, it protects the body from many things, so many of the diseases are prevented in females because of this hormone estrogen. So that is why after the menopause everything blows apart. Everything starts coming in, every diseases start occurring in females after their menopause. So females definitely after the menopause, they are again prone to the cardiac diseases. So if you look into the symptoms of the heart attack in females, you can see that the symptoms are mostly mild or moderate. It can be easily ignored. That is the reason why their fatality is more high in female patients than in the male patients. So saying that, how do you think the heart attack happens? Or what is the pathology behind it? So if you look into the anatomy of the heart, you can say that heart is an organ which is responsible for supplying blood throughout your body. Heart is always filled with blood, and this blood is being pumped out by a major artery called aorta. And this aorta have a lot of branches, and each branch carries blood to a certain organ or to a certain area. So although the heart is always filled with blood, this blood cannot be directly utilized by the heart muscle. It needs a special supply. So again, from the aorta, there is a small artery coming to supply and nourish the heart muscles. We call it coronary artery. It is like that beautiful phrase, like what goes around comes around. So the heart attack happens if the coronary artery, which is responsible for supplying blood to the heart muscles, get blocked. There are a lot of reasons why the block has been formed, like that of the congenital defects in the artery, unnatural spasm or narrowing of the artery. There can be emboli or block which is formed elsewhere in your body and has been carried to your heart. But the major reason why the heart block has been formed is because of the plaque formation, or we call it atherosclerosis. So here what happens is the fat will get deposited inside your coronary artery like a plaque, and over the period of time it gradually grows, and one fine day it will completely block the coronary artery. So fats has this property to accumulate inside your body cells. It can usually get accumulated in your omentum or the covering of the abdomen. It can get accumulated in your fat cells, we call it fatty liver. It can accumulate in the blood vessels, we call it atherosclerosis. It can get accumulated under your skin. You can see like a small tumors, soft tumors. It will be benign, we call it lipoma. It can get accumulated around your eyes. We call it xanthelasma. You can see, for me I have that condition. So fat have this property, to get accumulated somewhere else in your body. So inside the coronary artery, the fat will be entangled with the cell debris, with fibrin, and it will make the structure more concrete, and it will also weakens the muscle structure of the artery. So there are chances that it can end up in blockage, and also there are chances that it can rupture also. So that is about atherosclerosis is about. So if you have an unnaturally uncontrolled systemic diseases like that of the hypertension, so here what happens is the contraction take place unnaturally. It will not relax. So the pressure built up will be more, and it is the chances that the plaques might break, and it can create more problem. The rupturing can happen, and even the blockage can happen if you have an unnatural hypertension. So hypertension with cholesterol is a very deadly combination. So make sure you have the cholesterol factor and hypertensive factor under control if you are having any. And if you look into the diabetes factor, sugar as such will weaken your blood muscles, and it also will induce inflammation inside the arteries, not just your coronary artery, everywhere else it will create inflammation. So if you look into the legs of the diabetic patients over a prolonged period of time, you can see the discoloration happening. This is because of the reduced blood flow. So in the heart, as well as in the brain, in the eyes, in the limbs, everywhere else the blockaging or the vasculitis can happen and can cause reduced blood flow. Hypothyroidic patient, again the functioning of the whole of the body will comes down. So again that is a very bad condition for your heart. So if you are suffering from any systemic diseases, make sure you have it under check so that you can keep your body healthy and fit. So now let us come to the last question. How can we prevent a heart attack? So here lifestyle has to play an important factor in preventing heart attack. You have to exercise regularly, you have to manage your weight, make sure that you're eating the right food. If you ask me which is the best diet recommended for cardiac patients or for the healthy heart, I would say it is the Mediterranean diet or the DASH diet. This is the most good diet, or this is the best diet which is advised for the cardiac patient. In homeopathy, we have preventive medications to protect your heart. We have medications to strengthen the muscles. We have medications to reverse back the changes which is caused by the atherosclerosis, especially in the first stage. Beyond that, definitely it is a question. Pumping of the heart can be improved with medications, and this is regarding the heart attack. And so if you have any doubts or queries, you please mail us, you can please comment us. So we'll see to it that we'll reach out to you. And if you really enjoyed this section, please make sure to like, comment and subscribe, and also make sure that you share it among your friends and families. So saying that, you stay happy and fit and take care of yourself. Thank you so much.